Hello friends, today we are going to discuss about independent admission and admission of minor under Mental Health Care Act of 2017. Independent admission is nothing but voluntary admission. I am Dr. Suresh Bada, Professor of Psychiatry, working at NIMANS, Bangalore. Before I start my presentation, I would like to place this disclaimer. This presentation is for academic and training purpose only, not for legal opinion. If you want to have a legal opinion, please do contact an advocate. Conflict of interest? None. The objective of this video is to discuss independent admission, that means voluntary admission, and also admission of minor to a mental health establishment under Mental Health Care Act of 2017. This video is targeted to doctors, psychiatrists, mental health professionals, that is clinical psychologists, psychiatric social workers, and psychiatric nursing. Persons with mental illness and their family members will definitely benefit by this video, and also Mental Health Review Board members, State Mental Health Authority and Central Mental Health Authority members, and also advocate and police. Let's discuss about voluntary admission and also admission of minor to a mental health establishment under Mental Health Care Act of 2017. Mental Health Care Act of 2017 was passed in the Parliament and received President's assent on 7th of April 2017. In this legislation, we have two types of admission. One is voluntary, that is called as independent admission. Another one is involuntary admission, which is called as supported admission. Though the words are named, but the concept is old. With regard to independent admission, here we have again two types, that is voluntary admission of an adult and admission of a minor. Voluntary admission of an adult comes under 86. Admission of a minor is under section 87. Minor means any person below the age of 18 years. So let's discuss both of them in this video. The first, independent admission. As I mentioned, section 86 talks about adult for admission in any mental health establishment. He need to request for admission by himself or herself to the medical officer in charge. That person will be admitted to the mental health establishment after receiving the application. Similarly, with regard to admission of a minor under section 87, need will occur only when the request is given by a nominated representative or else legal guardian. The patient, that is the minor, will be admitted if two psychiatrists or else one psychiatrist and one medical officer, or else one psychiatrist and mental health professional clearly says, yes, this person will benefit by admission, will be admitted to the mental hospital. Moving to this adult admission, let's discuss in detail. Here, the independent admission, also called as voluntary admission, clearly mentioned under section 85. Independent patient or a independent admission refers to an admission of a person with mental illness to a mental health establishment who has the capacity to make decision with regard to admission treatment and requires minimal support with regard to decision. So, independent admission is being clearly defined under section 85, whereas section 86 talks about the procedure. Section 86, independent admission is done. The person who is requesting should be an adult, having suffering from mental illness, and he should have capacity to consent. That means his mental capacity is preserved. Along with that, he need to give an application, that is Form C, to the in charge of a mental health establishment. So this is how the procedure goes. Independent admission or voluntary admission. The person who is suffering from mental illness will give an application under Form C under section 86, request for admission by himself or herself. Patient will be admitted if a medical officer or a mental health professional is satisfied, yes, he requires admission and he will benefit by the admission. And he need to intimate the mental health review board if it is a child or a woman within 72 hours, if it is a male within 1 week. This is Form C. This Form C will be made available in every mental health establishment. So it is provided free of cost. So here the person who is requesting for admission should fill this pro forma. Along with, he need to give a photo ID card, which is the requirement to identify. This Form C is as per Mental Health Care Rules 2018, that is Rights of Persons with Mental Illness Rules. So under this, Form C is available, but it is the duty of every mental health establishment to make this forms available free of cost. So medical officer will consider the application if he is satisfied that the person with mental illness has severe illness requiring admission, he is likely to benefit from admission and treatment, and he has capacity to consent for mental illness. Here this capacity to consent is very essential. However, many people have criticized, since it is a voluntary, so what is the need for assessment of mental capacity? Because it is the requirement of the law here, because it says the voluntary admission is for a person who has capacity. Since they have mentioned there is the need for capacity, that means assessment is very essential. So for that reason, we are considering capacity assessment is mandatory under section 86 also. Again, if he is satisfied and a person is admitted as an independent admission shall abide by the mental health establishment rules. For example, visiting hours, what is the food time the food is given, at what time he will use mobile phone, availability of internet. So whatever the minimum rules which have been formulated by the mental health establishment, he needs to follow. And consent will be taken for every treatment, including the admission. Presence of nominated representative is not required. That means NR is need not stay in the hospital along with the patient, especially for independent admission. And the patient can get discharged on his own, on his request. The patient can request for discharge because he is an independent admission. He has a capacity to decide for his admission and treatment, so he can decide for even discharge also. So if a persons with mental illness will not be admitted under section 86, that is also mentioned. If he is unable to understand the purpose of admission and treatment, requires very high level of support, does not have capacity to consent. If these three criteria, if it is there, that person will not be admitted in under section 86. For example, catatonia. A person with catatonic schizophrenia will be passive, or else severe negative patient with schizophrenia, neither he will resist nor he will say no. In such a scenario, he may not be able to give consent because he does not have capacity. You will not revoke section 86 in such cases. You have to go for section 89. So that's what does it mean. And hence, section 86 is not applied in such cases. Now, let's discuss about admission of minor. Admission of minor means any person who is less than the age of 18 years. So, section 87 clearly says, a independent admission for a minor under section 87 is done by a nominated representative by filling Form D. And once the Form D is filled, then the patient will be admitted if two psychiatrists agree upon that yes, this child is suffering from mental illness and he will benefit by admission. That is very essential. Or else one psychiatrist and one medical officer, or one psychiatrist and one mental health professional. If any of these people give opinion, two of them, then the person can be admitted to mental health establishment. But however, since it is a minor, the person who is in charge of the mental health establishment should inform the MHRB that telling that we have admitted a minor within 72 hours. This is Form D. This Form D is made available or shall be made available in every mental health establishment free of cost. And this is again, he has to fill the pro forma along with the photo ID card of the child. Along with that, the photo ID card of the NR also should be made available here. So after receiving the application, two psychiatrists was, as I mentioned, or one psychiatrist, one medical officer, one psychiatrist, one MHP, either of them, if they certify independently, after independently examining the child, yes, this child is suffering from mental illness with such a severity who will benefit by admission, will be admitted. And the examination should be done either the previous day or within the 7 days of the admission. So in that way, then only the patient can be admitted. So this is the criteria what I have mentioned. Minor has a severe mental illness and it should be in the best interest of the child and will benefit from the admission. And one more criteria has been placed, but unfortunately, all community based alternatives to admission should have failed or not suitable. This is a difficult criteria because child psychiatrists are not available in the community. A child psychiatry treatment is not available in the PHC or the district hospital. Invariably, persons with mental illness, especially minor, is brought to the tertiary center or the mental hospital directly to the psychiatrist. In such a scenario, all community based alternatives admissions have failed. That means this is a criteria which is difficult to fulfill. However, it we can understand telling that first you try to treat the patient in the community, that is outpatient based. If that fails, then only you consider for the admission. And also, even in the first instance, if the child is severely ill, you can admit. That's what this clause means. Moving to, and shall be admitted, the child will be admitted in a separate ward. That is a very important criteria, because earlier we used to see in a mental hospital or in any hospital, the child and adult mental ill were used to be mixed. So as per the NHRC guideline and also now as per the Mental Health Care Act, you cannot mix the adult patient along with the child. So that is very essential. And here one more criteria is placed. When a child is admitted to a mental health establishment, a NR should stay. That is, nominated representative should stay with the child. An attendant or an attendant appointed will be staying with the minor. And if the child is a female child, so female nominated representative will stay, or else and a female attendant should be made available with the child throughout the stay, throughout the admission. That is very essential. And NR consent is must for treatment, admission and discharge. And the MHRB should be informed within 72 hours. And MHRB shall review the admission and records of minor and visit the patient and interview the minor if they feel. And mandatory review is placed within 7 days if the child is going to stay for more than 30 days. And if the patient continues to stay in the hospital for longer duration, every 30 days, the MHRB has an obligation to go and examine the child, or else at least review the file. That is the requirement as per the Mental Health Care Act of 2017. Let's discuss about Section 88, that is discharge of independent patient or minor patient from the mental health establishment. If a independent adult patient, that is voluntary patients, wants discharge who is admitted under Section 86 will fill the Form G. That is, the adult voluntary patient who is admitted will fill Form G and will give request for discharge to the person who is in charge of the mental health establishment. And this Form G should be made available free of cost in all wards. If the person admitted is a minor, in such a scenario, the nominated representative will fill Form H and he will request for discharge to the person who is in charge of the mental health establishment. And one more scenario is there. If a minor is admitted and during the admission he becomes adult, that means he becomes 18-year-old. In such a scenario, that admission of minor will be converted into admission under Section 86 as an independent admission by an adult, and he will decide whether he will continue to stay or else he will request for discharge. But however, please do remember, although it is an admission by a voluntary or through a NR of a minor, here under Section 88(3), subsection 3, mental health professional can prevent discharge of a person admitted as an independent patient or else a minor patient for a period of 24 hours for the purpose of assessment. And during the assessment, he finds the person who is admitted as voluntarily has lost his mental capacity to decide, or else he has become dangerous to self, or that means recently he has threatened or attempted to cause bodily harm or deliberate self-harm or attempted suicide, or else he has recently behaved or is behaving violently towards another person or any other person, that means dangerous to others, or else showing inability to care for himself to such a degree that the individual is risk of harm to himself. In such a scenario, the voluntary admission will be converted from section 86 to 89, that is involuntary admission. That means from independent admission to supported admission will be considered. To conclude, my dear friends, independent patient, that is voluntary patient, will retain all his rights although he is admitted to mental health establishment. No rights will be taken off for voluntary patients and he will request for discharge on his own. However, admission of minor will be done by the nominated representative and discharge also request will be done by the nominated representative. However, under the Mental Health Care Act, it is very clear the mental health professional can withhold discharge for a period of 24 hours for assessment, and during the assessment he finds that the person with mental illness has improved significantly or else he has capacity to decide, he will discharge him. Otherwise, if he feels the person is deteriorating and he has lost his capacity, he has become dangerous to self or dangerous to others, or else he is unable to take care of himself, in such a scenario the voluntary admission will be converted to supported admission under section 89. Thank you very much for giving your valuable time. Stay safe.